My name is Linda Dickey, and I'm the Director for Epidemiology and Infection Prevention at the University of California Irvine Healthcare System. I got more into construction and renovation, teaching and working with the guidelines writing, really as a result of an invitation from a colleague that was involved at the time, and she was looking to get others involved that are within APIC and within this industry. Her name is Judine Bartley, and Judine has mentored me quite a bit in that direction. And so I first met her and actually had heard of her through someone that I had worked with at a previous hospital before I came to Irvine. I think she's of the stature that many of us in APIC know her anyway, so I had heard of her, and then I worked with this colleague. And then I had an opportunity to go specifically and take a course related to healthcare construction, and she was one of the faculty. And we just hit it off like peas and carrots. We had a great time and saw a lot of things very similarly. And so we sort of kept in touch, and then a bit later she asked me if I would be interested in learning a bit more and starting to teach, and so it's just kind of evolved with time, and it's been fascinating.
What about it's fascinating to you?
Well, it's an industry that is completely apart from what we do day to day. It's, although I have to say, contractors are a lot like nurses in that they're very innovative and they're very creative, and they figure out how to make things work. Architects are again very creative. And I'm married to somebody who's of the creative variety, so I think it's a lot of fun to see the kinds of things they come up with. Ways that they can see how to develop healthcare environments, in ways that we might not ever even imagine. That's really cool to me. I think that's really interesting. And then to see how a contractor can turn that into bricks and sticks is amazing. And building from the ground up, from the dirt up, it's like, you watch the vessels, it's like blood vessels when you see the plumbing go in, and nerves when you see the electricity go in, and the skeleton of the building and literally the skin of the building, and it's like a human coming together almost. It's kind of cool.
What's one of the more interesting projects that you were part of where you got a chance to see this kind of magic?
Well, we did build a new hospital where I currently work. So, that was just an amazing process from the very beginning. They were already well into design by the time I joined my current organization. So I was able to jump in and learn a lot at that stage where it was, and then to see it go from demolition and creating the footprint where it is to a building where we actually have now moved in was a real opportunity, and I learned a lot in the process. Yeah.
What made you choose infection prevention? Take me back into your life. Where was the choice point for you? Why did you go into this field?
It's funny that you would ask me that, because somebody just asked me that 2 days ago. My mother was from the Depression era, and she always wanted to see me go into a career that I could feed myself and be independent, and she knew that nurses could usually get work. And she's a very practical woman, so she encouraged me to go into nursing. I can't say that I had any big desire to go in that direction. And after I got into nursing, I enjoyed it somewhat, but I really did not find direct patient care to be my forte. I would, be taking care of somebody. I'm like, time to get up out of the bed. I felt like I was a hard-hearted Hannah. Like, no whining. So I'm like, well, I'm not quite sure. I'm not sure if this is my direction or not. I met a woman who was in infection control at the time, and she knew that I was kind of looking, and she said, have you ever thought about this field? And I said, I have no clue what you do. All the people that were working for her were very seasoned, so I was a little intimidated. And so she handed me what we refer to as the APIC curriculum, big thick book, and I'm like, get a life. Who reads this? I took it home and I was fascinated. I kept flipping through. I'm like, oh, well, that's really interesting, and oh, that's really cool, and I could enjoy that. And so I came back in, she goes, well, what did you think? And I said, I really think I would like this. So she hired me, and I was able to work in a very large hospital system in the Orlando area. Great place to train. I had colleagues that were brilliant, and they exposed me to a variety of different situations and challenges that helped me grow up in this field. And then I moved to California. Yeah.
And so what brought you into this collaboration with environmental services? Tell me more about that.
It's a very informal collaboration, I would say. I've worked with a variety of environmental services directors at my facility. Some of them have been stronger than others, and that's helped me see what challenges they face when doing that job. I think their job is tough. And I think the job of the people that they manage is really tough. You know, we know as people who are trying to prevent infection that our enemy is invisible and is in the environment as well as on our skin and that type of thing. And I don't think that environmental services as a profession is honored and recognized to the degree that it plays a component in patient safety. So we've made it a specific effort to try to figure out what can we do to strengthen their practice, how can we connect the dots between what they do to help them see how it directly affects patient outcomes, and you know, what can we really do to make them feel a part of the whole healthcare team, because it's not just the physicians and the respiratory therapists and you know, those that are putting their hands, it's people like me who are behind the scenes, it's people like them who are cleaning the environment that also have a part in that.
What kinds of things have you done?
Well, most recently, I think I was talking with you about this on the phone, most recently we developed a poster campaign. So when we moved into our new hospital, one of the things that we did was we captured some real estate. We put very nice framed pictures on the wall with posters that we change out occasionally with different types of campaigns, and we work with our marketing department to create those and make sure that they're visually tied in with the marketing materials they're developing for the hospital. So we've done hand hygiene, we've done influenza, a variety of different things. We decided that, well, what can we do to honor our colleagues in environmental services and emphasize that cleaning surfaces and cleaning the environment actually affects patients' lives and saves lives. And so we thought, well, let's do a poster campaign. And we thought, well, we'll take pictures of the EVS staff and that type of thing. And then we thought, well, let's broaden that, because it really needs to be that more people need to see cleaning as a part of their scope of work as well. It also helps tie in the fact that they're all a part of the team. So we have photographs of physicians cleaning their stethoscope, for example, nurses cleaning, you know, devices that nurses would normally clean, or nursing assistants, and then the EVS workers doing some cleaning as well. And they've been really well received. The environmental services staff was like, "Oh man, that's really cool," you know, and they'll see one of their colleagues in a poster on the wall, you know, I think it's really helped them feel affirmed and that they're appreciated and that they're recognized, because they definitely are one of those types of professions where they do their job, but they're like a ghost, and people, you know, many times don't even make eye contact or don't speak to them. And you know, what would that feel like? I think that'd feel really yucky, you know? And what they do is important.
I hear that. I hear the conviction that you have around that. So it must have been very rewarding with you.
It was a ton of fun too. You know, it's great when you work with a group that you've not really interfaced with before, and I mean, they're just a kick in the pants. They just are. They have great personalities. You know, they laugh. When they get around each other, they enjoy each other. I think it's a lot of fun to be able to have them see another side of someone that they might see as an administrator who wears a suit, and you know, and then all of a sudden you realize you can look at each other with a twinkle in your eye and realize you're working for the same place and for the same reasons, and it breaks down a lot of barriers.
And what do you think the outcome of that is?
Well, I think it's the start of a process, or you know, along a process. I think what it does is that when we, from infection prevention, partner with EVS to talk about, okay, let's consider the quality of what we're doing. How can we improve that? Where are our weaknesses? Where are our strengths? There's more reception there on both sides. I think it's so easy to not hear one another in any type of environment if you haven't first built a bit of rapport and a bit of trust. And so it's for some people it might seem like, just a silly thing, but to me it's just a step towards building relationship.
It seems like the job they do is critical. There's a lot of importance on it. So, and there's a lot of protocols around that they have to follow. They're responsible for executing.
Right.
How does that fit in with the rapport building that you're talking about? Tell me about what happens when those things work together.
Well, for example, an environmental services worker in the operating room is really pushed to turn that room over fast because the OR time is money. It also can be critical to someone's life, so they want to get people in those rooms quickly. Meanwhile, you've got this person who has people like me saying you need to clean thoroughly and you need to clean well. So there is a natural friction that occurs with just the operation of that environment. So, trying to think about that as a collaborative team and think, okay, what are we trying to accomplish here? We don't want to expose patients between cases to anything. How do we thoroughly clean and keep these rooms going so that this person can accomplish their job without constantly bumping into, we're not constantly knocking heads. So you would involve, someone from the operating room and someone from EVS if we find issues that need to come up, if the room's not being cleaned thoroughly enough, if they're taking too long, try to get common goals built, that type of thing. There are a lot of areas where you can have rubs like that, areas where there's intimidating equipment to clean, robotics or a lot of computers, delicate equipment, vivariums, where there's animals, areas where they don't feel comfortable, areas where they're doing research and they're afraid of exposure. There's all types of things that I think we need to make sure they're not afraid and they can go in and do their jobs with confidence. And you don't find that out until you really work a little bit more closely with people and you find out, well, why aren't they going in there? We had an issue in our facility with the morgue. They were afraid to go in there. It is a kind of a creepy place, especially on night shift, to go into the morgue. So we just had to talk about that and try to figure out, well, how can we accomplish this? Is there something during the day? Is there something where two people can go? Are there ways to accomplish the goal in a different way that can address whatever the concerns are? Is it a different assignment for a different person who doesn't find that intimidating?
And so, were those all solutions that you came up with? What you just listed?
Yeah, I think you have to just kind of work with the operational needs of the EVS department and the department being served, and just find out, okay, what will work here? What's the root of the issue? And what are we trying to achieve? And how do we get there? And it's like what anybody does in any work environment is problem solving 101, but if somebody else is pushing the solutions on instead of involving those who are in the thick of it, it usually doesn't work. So
you spend a lot of time getting them involved, getting them engaged.
We try to. We work a lot with the managers of different areas. We try and are actively continuing to talk directly with EVS staff. There are challenges with that, much like there is with direct care providers in terms of actually getting time with them. So, they obviously can't be cleaning and doing whatever their normal assignment is if you need 30 minutes or an hour of their time to ask them, well, what are your thoughts about this? What are the barriers here? How can we make this better? How would this better communicate to you? Those are important things, but you really do need the input of the people that directly do the work. I have a new staff member that I had just recently hired. She's fabulous, she's young, she's just entering our field, and she had done some of her work in setting up projects with environmental services when she was in school and some of the internship work that she did. So she's continued that when she came in, and she worked closely on the poster campaign. She has such an enthusiasm for working with EVS, and that's contagious for them. I think they see that, and I think they value that she values them.
So it creates kind of a virtuous cycle.
Yeah.
Uh-huh.
Yeah.
What's behind her enthusiasm? Why do you think she's passionate?
I think that she recognizes their job is tough. I think she's the kind of person that genuinely appreciates other people, no matter what they do, and she respects other people, and you get that sense from her. So I got that sense from her when I interviewed her, and our whole team interviewed her, and you have to definitely be someone when you're an infection preventionist, and really I think any kind of facilitation role where you can work with a variety of different individuals, from physicians who are, well educated, sometimes a bit intimidating, a variety of personalities just like anybody else, to individuals that clean the instruments and sterile processing, clean the hospital rooms. You're going to have a variety of different individuals with different educational backgrounds, and you've got to be able to flex with that and work successfully in that environment.
It sounds like collaboration, because you just named a whole bunch of different stakeholders. Collaboration is important to you.
It is. It is. And one thing we've also talked about trying to do to get our physicians to be more collaborative with EVS is when we have opportunities to talk with them, we haven't done this yet, but when we have opportunities to speak at grand rounds or in different settings, to tell them, there is one thing you could do in the course of a day that costs nothing, and it could be a significant help to protect your patients, and that is to make eye contact when you see an environmental services worker and just say, I appreciate your work, or thank you for doing that. And I think coming from a physician to an EVS worker, that would help significantly in changing a culture, especially if you can get these people to do it with sincerity. You don't want them just to be parroting it because I told them to do it. But if they really kind of get it, that is contagious. And somebody else will see them doing that,
So you must be working in a culture that supports collaboration.
Absolutely. Yeah, and expects it. And if you don't play well with others, you don't succeed at our organization. You really need to be able to learn how to listen to what somebody else's goal is and what they're trying to achieve, and to see how you can mutually help each other figure out how to get there. Because many times you have conflicting goals. And so how do we help each other both succeed? And sometimes it's I have to kind of give up on something, or sometimes the other person does, or sometimes we figure out how it can be a win-win. But the expectation is that we respectfully work towards that every time. I love that. I think that's good. Yeah.
What kinds of services or products could come out of this year that we have in front of us that you think would help?
It would be really fun. What would be really fun is if we could create some sort of visual educational tool that was engaging, that was funny. It makes its point in terms of connecting how important the job is of the environmental services worker, but had humor and could walk them through some examples of work done poorly and work done well. For example, you could have someone who is just loafing and cleaning something haphazardly or not cleaning it well. Somebody else who's very fastidious but doesn't have very much humor, and then somehow, how I'm thinking of a Reese's commercial where you get the chocolate and the peanut butter and somehow they come out with, I don't know what it would be. And, we certainly have to get some creative minds working on that. But I think something like that, A, would be a lot of fun to work on. B, I think that in our environment, healthcare is notorious for having education that's like, could you please just put me out of my pain now? It's just horrible. And we've got, we have a whole new generation of people coming up who are gamers, and we actually, in one of our areas at the hospital, they work a lot with robotics, so they actually test them on gaming to see how they'll do with working with those instruments. So we have a whole new generation coming up, and how they learn and how they engage is different. And not to say that the people that are currently in front of us, we have to take that ultra step, but I think we can go much further in developing something that that's engaging and will help them, and also those outside of EBS, maybe a communication piece to physicians or nurses or respiratory therapy, other disciplines, to say, this is who these people are, and this is why they're of value, and this is what you can do to engage them. Just something that would be engaging and would be fun. Because if we were able to do that, I think it would go viral, and people would say, you got to use this. I used it at my hospital and they loved it. And people will hear that, and then they'll want to use it. We talk infection control where I think we're over 13,000 members now. I don't know how many are in APIC, but we are like a little community. We talk to each other. I call my friends in Boston and wherever. And if something is good and it's effective, it spreads like wildfire. And it would be really fun to come up with something like that.
You mentioned, started to list other stakeholders. Who, besides the infection preventionists and the environmental services group, who else needs to be touched in order for something to be a real success?
I do think other types of clinical disciplines. If we create something that could be flexible enough, and it would need to be, it can't be long, but if it could be flexible enough that you could drop it into educational venues for other types of disciplines, and humor is just essential. That's a universal language, but I would love to see us engage other types of clinical disciplines. Also, even those individuals who are in the construction industry, something that we could use to communicate to our contractors how important it is to engage environmental services when they're working on a project. Because, when we are working to build something and that environment is dusty or has a lot of soil, it's got to be cleaned really well before we move patients in there. And it's the job's not done until that's done. So EVS is a part of that team as well. So I could see a broad application of something to show, this is how they're important. This is how they're important. This is how they play a role. And this is how you can help them see the value of what they do.
Do you have any examples of anything that you've seen that's humorous that it's worked out?
Well, my son used to be a big Scrubs fan. I don't know if we can go there, but I think that we need to, it's a fine line, because in healthcare we have people's lives in our hands. So you don't want to be flippant or glib or make people think that we don't care. At the same time, I think shows like that exist for a reason. People do see humor in things, including those of us in healthcare. So I think something with a little bit of a tone like that, not sure where we'd find, I'm from Southern California, got a lot of good writers out there, but obviously they cost a lot of money. So, I don't know. We'd have to find somebody who really could help us write something that would be effective. But I just think that there's a real opportunity there. I don't know. It could be something animated or live action. I don't know.
We're coming to the end of our time. Is there anything that you wanted to talk about we haven't touched on?
There are so many things that I think will probably come up tonight, but I just really appreciate the opportunity to be able to work with Bill Rutola, for one thing, and David Weber, and the other colleagues that are going to be on this panel, and to learn more. I by far know that I have a lot to learn about what makes an effective environmental services program, and what engages those individuals with others to be a part of being able to figure out how to help others within our profession and outside of our profession do that is going to be a lot of fun. So look forward to it.
Thank you.
Yep.